Good afternoon, and thank you all for joining us today on Monday. We celebrated a major milestone over the weekend with more than 100,000 Mississippians receiving vaccinations for COVID-19. That's something we can all be proud of as we work together to get even more access to even more Mississippians. In fact, we have administered 105,228 first doses. We have 9,719 Mississippians who are fully vaccinated. So we've administered 114,947 total doses in our state. We went in a relatively short period of time from being 50th out of 50 to scheduling every vaccine that we possibly can. Now, I know that a lot of people have had trouble with the website and have had trouble with the call center over the last week. And I'm, just like you, not happy about that. But I also realize that that is the nature of launching a product that so many people want. We can't get everyone their shots in the exact place that they want them at the exact time that they want them. We can get all of the shots that we have out as quickly as possible. And we can give as many people as possible a chance to get in line. And that is exactly what's happened. Tens of thousands of Mississippians were able to get through and get an appointment last week. And we're delivering those doses as quickly as we possibly can. Regarding those customer service issues, Director Michelle will have more details later, but his team worked tirelessly over the last week and all weekend, working with the team at the Mississippi State Department of Health, the University Medical Center, and other IT experts. They have made tremendous progress. In fact, late yesterday, the website was surge tested, and it was able to handle 6,000 users simultaneously hitting the site every single second. Nothing shocks me anymore, but we should not have significant additional issues going forward. The call center was tremendously bulked up. I believe I heard the term quadrupled in size, with more lines and more people to communicate. I cannot promise zero wait for everybody, but I can say that there should be less of a wait for everyone. We are opening more locations and loading more appointments as we speak, including 1,200 doses at drive-through sites in Hinds County. Our partners in clinics, hospitals, and FQHCs will get an additional 5,800 doses this week. Those are first doses. In addition, there are currently 144 hospitals and private clinics that have approximately 50,000 doses that can be put in arms this week. Of those 50,000 doses, approximately half of them are first doses. Now, here are some of the remaining limits on our abilities going forward, at least as I see them. Number one, we can give out as many vaccines as we're given, but we can't do more than that. I promise to do everything in my power to get every single dose out, but there are still more people who want a vaccine than there are doses available. So we do still need to recognize that and exercise some patience. This week, for instance, we have 37,000 doses already allocated to us. We are working to get additional allocation by moving some of those that are currently allocated to long-term care facilities over to our general population. In the analysis that we've done, and I'll be happy to answer questions about this, it appears that the federal pharmacy program over-allocated to that particular program relative to the number of individuals that are actually going to take it. We've already convinced them to give us an additional 5,100 doses, and we hope to get about that many more this week. We're working through that process. But still, we can't give doses that we don't have. Because of that, all told, we've got 37,000 doses that we were originally allocated. We've got an additional 5,100 coming, and there are approximately 25,000 first doses at either hospitals or private clinics throughout our state. So our maximum capacity this week is approximately 67 to 68,000 first doses. We won't get all of those in arms, but we're going to get a large majority in arms this week. Number two, we have to be flexible and adapt as we learn more, and we have to be guided by data. I just got the information on every one of our partners that is distributing the vaccine on Friday. When I say partners, as you know, there are 4 different avenues of distribution here. There is the federal pharmacy program, which is doing long-term care facilities. There is, number 2, the state-run clinics, which is a partnership between Mississippi State Department of Health, MEMA, and of course our wonderful men and women of the Mississippi National Guard. Number 3 is our hospital program, and then number 4 is our private clinics. There's approximately 147 on the list. When I got it on Friday, approximately 94 of them, almost 2/3, had given out less than half of what they had been allocated. So just about 29 of them were actually above 65%. So we made the decision that this week we will only send additional vaccines to those providers who have given out at least 65% of their current doses. The vaccines that we don't send to sites that are falling behind can be used to support sites that are efficiently getting the vaccine out, whether it's our drive-thrus or a hospital or a clinic. Let me be clear, I don't care as long as it gets done and as long as shots get in arms of Mississippians who want it and who need it. And I will tell you, we have seen many of our hospitals and many of our clinics do a great job, and we certainly have gotten nothing but positive feedback from our state-run facilities, particularly those men and women from the Guard who have done logistics, those medics who have put in shots, and those staff of the Mississippi State Department of Health who have helped make that run smoothly. Number 3, we still need to finish our nursing home vaccinations. That plan was negotiated by the federal government. But last week I got on a call and spoke with both Walgreens and CVS myself to have a conversation about where we found ourselves. They continue to tell me that we're on the track for most all of our nursing homes to be served by the end of this month. In fact, I have fairly significant data now which shows that approximately 95% of all nursing home residents will have access to the vaccine by the end of this month. What we're seeing there, and I said this last week and I'll say it again, somewhere between 75 and 85%, this by the way is a national issue, but somewhere between 75 and 85% of all nursing home residents are opting to take the vaccine. Somewhere in the neighborhood of about 1/3 of all employees of nursing homes are actually choosing to take the vaccine. That's a challenge that we're going to have to work through in the coming months. Number 4, as we move particularly into next week, we have to prepare for more second doses and to expand first doses to our first responders and our teachers. Many of them fit into the category of the most vulnerable, and some of them qualify by age, but quite a few do not. So we want to make that expansion as soon as we can, but we're not there yet. Mississippi is achieving something incredible. We're all a part of this effort. I can promise you that we will work without ceasing. We will do everything in our power to eliminate every roadblock and open access as quickly as possible to everyone. We will rise to the occasion and we will protect as many people as possible. There is no higher priority, and we're acting accordingly. I want to thank again the men and women that are working long hours to make this a reality. The employees at the State Department of Health, the employees at the Emergency Management Agency, our men and women of the National Guard. I will tell you, we had a meeting in my office approximately 2.5 weeks ago with stakeholders in each of those entities and agencies. And what I said to them then was that I wanted us to approach vaccine distribution as if a hurricane was in the Gulf and we were going to take a direct hit. I wanted us to do everything in our power to expand not only the number of shots in arms, but also the number of vulnerable Mississippians that we protect. And what's happened over the last 2 weeks is people all over this state have stepped up and they're making a difference. Now, we're not where we need to be, and we got a long way to go. With 100,000 Mississippians vaccinated, we've got hundreds of thousands more to do in the coming weeks and months. But I want you all to know that there are an awful lot of Mississippians that are doing everything in their power, doing everything possible, working long hours to get this vaccine distributed, and I, for one, am proud of them. We've also seen positive movement in terms of total number of new cases. We've seen very positive movement over the last week to 10 days in total hospitalizations, total number of patients in ICU beds, and as well as total number of patients on ventilators. That's very positive. And so we have Dr. Byers with us here today. Dr. Dobbs is otherwise occupied. I think he had a meeting with the Surgeon General perhaps. But Dr. Byers is obviously right in the middle of it and will do a great job giving us an update on where we find ourselves. Dr. Byers, thank you for being here.
Thank you, Governor. So today, as y'all have seen, we're reporting out an additional 1,457 cases and 3 deaths. I would caution you with the 3 deaths. We've seen some low numbers of reported deaths over the weekends before, and we feel like that's primarily a reporting issue. If you remember, last week we reported out 98 deaths, highest one-day total that we've had so far, and those were reports that we received on the Monday after that weekend. So we are still seeing deaths in Mississippi. We are still seeing numbers of cases in Mississippi. We hope to see some moderation in both of those in the coming several days. I think that there are some indicators that show when you look at that we may be on the verge of starting to see some declines in the state. I think a lot of that may have to do with us getting past the holidays, hopefully, and we'll see that we'll have a decline in the number of cases and deaths. But remember, when we have a big surge in the number of cases, typically we will see those deaths that occur anywhere from 7 to 14 days after those increases in cases. So, we're not out of the woods yet. We still need to do those things. In addition to broadening the availability of vaccine and getting as much vaccine out to our partners and through our drive-through clinics as possible, we want to make sure that people still understand that they need to do those things that we've talked about for now almost a year, wearing your mask, social distancing, avoiding those large gatherings, trying to pare yourselves down to those essential services that you need to do. We are still seeing an impact in nursing homes, obviously, and we have had, at last report, over 150 outbreaks in nursing homes. But when you look at those, a lot of those are 1 and 2 cases in nursing homes rather than some of the larger numbers that we've seen. And certainly we're not seeing nearly the impact in deaths that we saw in nursing homes early on. We are working with the governor and working with MEMA and the National Guard to get those doses out that we receive from the federal government on a weekly basis out as quickly as we can. In addition to getting those first doses out to support our drive-through clinics, we, as the governor said, have made a modest amount of vaccine that we had available to our partners that we sent out to several clinics. We hope that that's not only going to broaden the reach and availability, but also to address some of the disparities that we're seeing with who's getting the vaccine, and that's very important at this point. Moving forward, we're going to ensure that not only are the first doses sent out, but for those facilities that have received those second doses, it's important for us to get those out as quickly as possible to those facilities so that they can ensure that the people that they've vaccinated with the first dose have the opportunity to receive that second dose as well. It's important for people to get both the first and second dose to make sure that we are fully protected. Governor, that's my report for today.
Thank you, Dr. Byers, for your courageous efforts and for being here with us today. At this time, I am going to turn it over to Director Michelle, who will give us some updates from his perspective.
Thank you, Governor. Just real quick to address Governor Reeves' comment on the website. Yes, there was an extremely amount of work that was done over the weekend getting the website stood up to handle the amount of surge that we can anticipate not only today, but over the course of the vaccination schedule as we increase the number of opportunities. I do want to say that along with members of my team that it was a phenomenal team effort from the Mississippi Department of Health, individuals at the University of Mississippi Medical Center, and ITS all worked extremely hard and long hours this weekend, so really great job. And I'm very confident that the user experience on the website will be much different from this point forward. I do want to point out that the intent was to be able to give the user the opportunity to view available appointments as they enter the site, as opposed to going in a queue in a waiting room and waiting to see it. So it should be a much quicker opportunity to get in, see what's available. If nothing is available, get out and then come back later. Also with the call center, again, users should expect a better experience now as far as busy signals. You should not get busy signals. What you may find is a longer wait time, depending on where we are in queue with appointments. But you should not experience a busy signal, and your wait times, even with a wait, should be much lower at this point. There were 20,000 appointment opportunities were loaded today. That includes one additional day for Hinds County this week was added, 400 appointments, and then next week there are going to be 3 days in Hinds County. That was a great demand that the call center reported. So it'll be the 3-day vaccination sites in Hinds County for a total of 1,200 appointments there, and then all total 20,000 opportunities loaded today. Just a real quick, also, with their 19 locations that the National Guard is doing that are manning those sites, some of those site locations have been modified to increase throughput. So we're looking at vaccinating 30,400 this week, and then with the addition of the Hinds County sites, 31,200 next week. So again, we continue to ramp up the opportunities. Finally, just to remind everyone about how to register for an appointment. You've got 3 ways. First of all is going online to the website. That is going to be what we recommend you do first. That is COVID vaccine. That is covidvaccine.umc.edu. If that site does not work for you, do not have access to the website, the call center number is 1-877-978-6453. And then you can also contact hospitals and clinics directly to get appointments. You want to call them directly. Do not go to the website or the call center. That is only for the drive-through clinics. Other than that, Governor, that includes my update, sir.
Thank you very much, Director Michelle. I appreciate your team's effort and the collaborative work that was done over the last week to increase capacity. I know we were here, I believe, last week on Monday, if I'm not mistaken. As you know, there was snow on the ground throughout much of Mississippi last Monday morning, and there were men and women of the Mississippi National Guard that were standing in that snow directing people through sites so that they could get their shots on Monday. And I personally want to thank them. We've worked with General Boyles to look for opportunities to expand the number of medics that we have available, because as we move into the next couple of weeks, we're not only going to have first doses and first dose appointments that we're running through our own sites, we're also going to have second doses coming online with both Pfizer and Moderna. And I have not been told if this has changed, but we do currently believe, and Dr. Byers, correct me if I'm wrong here, but we do currently believe that if you got a first dose Moderna, you need to get a second dose Moderna. If you got a first dose Pfizer, you need to get a second dose Pfizer. And so part of that is incumbent upon us to make sure that the same facilities get the same specific vaccines. But part of it is on you as well as the people to not only know that you have received a card that has what that dose is, but we'll work on that as we move forward. But I want to thank General Boyles and his team and turn it over to him, please.
So, Governor, I'll just simply say we've got a little over 1,000 men and women, both Air Force and Army, that are on duty today, working 15 sites. We're not testing today, but I'm sure we start testing again tomorrow. I'm pleased with the way the traffic moves through the sites. Governor, I will tell you that we have capacity to build on that and to keep the traffic moving efficiently while we're adding more lanes and more opportunities for folks to get shots. So we've got that capability there. My limiting factor is space, as you might imagine. So we're working on that. It's also medics, and I believe we've got a good solution for you on medics also. So I don't think we're going to have a limiting situation at the sites. It's just how many shots you won't put in arms. And you're right, we are prepared to work through inclement weather. We do have some inclement weather coming in this weekend, but we plan to be there to put shots in arms on Thursday and Friday, Governor. The last thing I'll leave with you, what I've learned in my travels on the sites too, is that we are prepared to mitigate against the Moderna and the Pfizer, the different shots that need to be done at any given site, and that's a very simple solution by putting people in one line for one and one for the other. So we're discussing all those scenarios, and we're prepared to respond accordingly. Governor, that's all I've got for the report.
Thank you, General Boyles, for you and your team. With that, I will again thank everyone and open up to questions. Scott had his hand up first, I'm afraid.
Governor, is there a uncertainty about a vaccine flow for the state? Because last week we got a statement from the health department how world changed within 24 hours, and seemingly the implications they were not prepared for what we asked for and demanded last week. What are we looking at going forward in getting and securing vaccine medicines?
Yeah, I don't think the world changed last week, but what I will tell you is there is always uncertainty in terms of how much vaccine we're going to get on a weekly basis as it currently exists. We typically learn sometime early to the middle part of the week what we anticipate that we're going to get the following week, but we're not able to order it usually until Thursday evening for the following week. And so we think that the number of doses should be fairly close and in line. But just like this week, we're looking for opportunities to press that. For instance, as I mentioned earlier, we got 37,000 doses allocated. Half of those, by the way, are Moderna and half are Pfizer for this week for our state-run plan and for our partners. But we're trying very hard to repurpose an additional approximately 10,000 of those that were currently allocated for the long-term care facilities because we think that particular program is over-allocated. And so we think that particular program is of utmost importance because as Dr. Byers mentioned earlier, the number of fatalities that we had early on, and it's a congregate setting, it's typically people who are older and typically people in a lot of cases that have various comorbidities. And so the long-term care facilities create as much risk as any. So we want to make sure we have 100% of the doses available for them to get in arms as soon as quickly as possible. But even so, the way in which the federal government counted that particular program, in our view, they just over-allocated there. So,
Yes, Governor, for people who are listening right now, y'all talked about how y'all are expanding the website, getting that ready for high surge traffic. But does that mean that there's stuff right there? There's appointments online right now to go get? And if not, when should people be coming back to check the website to see if they can schedule an appointment?
Well, there are a lot of people in Mississippi who watch these 2:30 press conferences. And I'm sure some of them that are watching now are already on the website and are already making phone calls. I have no doubt about that. But yes, there are appointments that are being loaded as we speak. And so there will be appointments available at our state-run sites the week of 125, which is a week from now. Our logistics team with health and MEMA and National Guard laid out that plan at their Sunday meeting yesterday. And as that plan is finalized is when we can then add those appointments to the website. But we had 30,000 appointments for this week, Monday through Friday. That's the week of 118, so that's today through Friday. They were taken up very quickly last week, and then we're doing the same thing